Hi, this is Dora Furtado, and I'm going to be performing a newborn physical assessment. Here's the baby I'm going to be using. So I'm going to knock on the door and then tell the parents that I'm the nurse today and I'm going to be performing a newborn assessment on their baby. And then I'm going to close the curtain for patient privacy and wash my hands. I'm going to confirm the baby's wristbands or leg bands with the mom's wristbands in order to confirm that I have the right baby, and also just confirm with the parents that this is the correct baby. And then I'm going to wash my hands and I'm going to put on gloves. And then after that, I'm going to place the baby on the weighing station so that I can get their proper weight. And then after that, I'm going to put them on the table, usually with a blanket on it or some sort of warmer underneath so that they don't get cold. And then after that, I'm going to take a tape measure and I'm going to measure the head circumference and then measure the circumference of the chest, and same thing with the abdomen, measure their circumference of their abdomen. And then I'm going to measure from the crown of their head all the way down to their heel to measure the baby's length, and keep note of that. And then I'm going to see their respiratory effort. It looks like the baby is breathing fine and the skin is pink all over. There's no rashes or abnormalities of the skin that I'm taking note of. So then I'm going to listen to the baby's heart sounds. So first I'm going to warm up the bell so that it's not so cold when I put it on the baby's chest. Again, I'm going to be using the bell of my stethoscope in order to listen to their heart. So I'm going to listen for a full minute. And then when listening for a full minute, the baby's heartbeat should be between 100 and 160 beats per minute. And then after that, I would listen to the lung sounds on both sides for a minute. And we do this by putting it on the sides of their abdomen or the sides of their chest, because that's the best way to hear it since their lungs are so large. And then listening to the lung on the other side. And usually their respirations, I would count their respirations, and it would be between 40 and 60 breaths per minute. Also, I would listen to their lung sounds for a full inspiration and expiration each time I listen. So then after that, I would listen to their abdomen. So same thing with an adult. I would listen to their right lower quadrant, and then their right upper quadrant, left upper quadrant, and then left lower quadrant. And then while doing all of this, I would note that their chest expansion is symmetrical and that there are no abnormalities or asymmetry within their chest and their abdomen. I would also note that their abdomen is soft and rounded. And then after that, I'm going to palpate for their anterior fontanelles. So I will palpate that, and then I will feel the coronal suture on top, and then the sagittal suture down, and then in the back here, the lambdoid suture, I would feel for that and make sure it's intact, and then the posterior fontanelle. So I would ensure that there's no swelling or deformities of their head and make sure that all the sutures and fontanelles are intact. And then after that, I'm going to look at their eyes. I can see that their face is symmetric. I do not see a flattened nose bridge or any congenital defects within their facial expressions. So I would look at their eyes and make sure that they can follow my pen light with their gaze. Make sure that the pupils are round and reactive. So eyes are perilla and EOMI. And then I would use a device to find the pupil reflex. So pretend that I have that and shine the light in both eyes. And I see the red reflex in both eyes, so that's good. And then after that, I would move on to the ears, make sure that there's no webbing and that there's no abnormalities and that they are symmetrical on both sides. And then I would flip them forward to make sure that they go back. And then I'm going to look at their nose, and their nose, for patency, I'm going to occlude one nostril and then the next, and make sure that they're patent on both sides, which it is. babies are predominantly nose breathers, and make sure that there's no other occlusions. And then I'm going to look in their mouth, and I'm going to feel for the soft and hard palate and make sure that they're intact and that they do not have cleft palate. So the baby's good. And then I would feel for the sucking reflex. So they would start sucking on my finger when I put it in their mouth. And then after that, I'm going to move on to their neck, make sure that there is no webbing. And I'm going to feel for their rooting reflex. So I'm going to brush their cheeks on both sides. And when I do that, their face is going to move towards my finger when I brush it. So again, there's no webbing on the ears or the neck. And then I would move their head to the left and to the right to ensure that they have full range of motion of their neck. And then I would feel for their clavicles to make sure that there's no fractures on both sides. And then I'm going to feel their arms for their brachial arteries on both sides. And I can feel both of them, no abnormalities. And then the same thing with the femoral arteries on both sides on their legs. And then I feel them, and they are 2 + and equal on both sides for both brachial and femoral. And then after that, I'm going to look at their fingers and count for 10 fingers, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then I'm going to see that their arms are flexed, which is normal, and flex and extend them to make sure that they have full range of motion. And then again, looking at the chest, looking at the nipples, make sure that they have 2 and that there's no bleeding or discharge. And then I'm going to move down to their umbilicus, and I'm going to see that there's 2 veins and 1 artery, and that the clamp is tightly in place, and that there's no skin irritation or bleeding noted. And then I'm going to move down to their legs. There's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 toes. And then I'm going to check for their reflexes, flex and extend. I'm going to ensure that their legs are symmetrical when I extend them. And then same thing with the arms. When I was flexing and extending, I make sure that the arms are symmetrical on both sides. And then I'm going to feel for the palmar reflex, or the palmar grasp. So I'm going to put my fingers underneath theirs, and they're going to clamp on. And then I'm going to do the same thing with their toes. Put my fingers underneath their toes, and their toes would clamp on. And then I'm going to do the Babinski test, and I'm going to rub their soles of the feet, and their toes would extend outwards, so they have a positive Babinski test. And then after that, I'm going to then look at their diaper, and I'm going to pull down their diaper and see that either if they have a vagina, that they have a urinary meatus and a vagina hole, and then the labia minora and labia majora is in place. If there's any discharge or bleeding noted, that's normal because of the mom's hormones, since this exam is done shortly after birth. And then for the male, I would ensure that they have a urinary meatus at the top, and I would pull down foreskin if they are uncircumcised, make sure that there's no skin irritation or abnormalities. And then I would feel for their testes to make sure that they have descended, and there's 2 of them, and that they will move freely and are soft in my hands. And then after that, I will pull the diaper back up, and then I would turn the baby over, and I'm going to listen to their heart with the bell of my stethoscope again on their back. And then I'm going to listen to the long sounds on both sides. Okay, and then after that, I'm going to look at their spine to make sure that there's no abnormalities, that their spine is in place, that there's no sacral dimpling, and that they do not have any Mongolian spots, although if they did, that would be normal. And then I'm going to look at their anus to see that it is there and that there's no abnormalities and that the anal sphincter is tightly closed. And then after that, I'm going to put the baby back down, and lastly, take their temperature. I'm going to take their temperature in their axilla, and so I would make sure that their arm is closed and that it is in the proper place. And I note that the temperature is normal. Then after that, I would put the baby back in its swaddle, and then I'm going to remove my gloves and wash my hands and give the baby back to their parents, and then tell them that everything went well, and it asked if they have any questions, answer any questions that they have, and then again wash my hands, and then I would leave.